All I have to say is, wow. Sharita, thank you. Another round of applause. Also, if you don't mind, another round of applause for Julie, Lillian, and Gail for that previous discussion. Amazing. As mentioned, I'm Jeff Curtis, Senior Vice President, Corporate Affairs and Chief Communications Officer at Horizon Pharma, one of the sponsors. I am truly honored to be here. After hearing those first two talks today, truly honored to be here, to listen, to learn, and just to leave here and empower, and hopefully empower for good. I'm also honored to work for a company who sponsors events like this and continues to have a relationship with the council. It is our responsibility to take what we learn here today, leave, and empower. So let's hope that we can all do that. Our next conversation will highlight the importance of early investments in maternal and child health, nutrition, and education, and why they are so critical to ensuring healthy futures. The World Health Organization estimates that 1 in every 4 children under 5 years of age is stunted. Often this physical and mental damage is irreversible and leads to reduced workplace productivity and income. We know that the impact of poor nutrition early in life has lasting effects. Globally, malnutrition and stunting cost between $1.4 and $2.1 trillion a year, the equivalent of 2 to 3% of global GDP. Ensuring improved nutrition during the first 1,000 days is absolutely critical. Not one organization or government can tackle these global health challenges alone, which is why partnerships have tremendous power to produce strategic and improve sustainable outcomes. Today's panelists will share why health is the foundation for healthy and prosperous futures. What progress has been made, what are the gaps, and how can partnerships be effective? I'm going to highlight quickly the speakers, some of the achievements on the speakers' bios, and then jump right into the panel. Dr. Laura Jana, in the middle, is a pediatrician and author who has devoted her career to addressing the needs of children, families, and communities. She most recently served as Director of Innovation at the University of Nebraska Medical Center and is currently faculty member at Penn State University's Prevention Research Center. She also serves as the American Academy of Pediatrics spokesperson. Michael Nyenhuis is President and CEO of Americares, a health-focused relief and development organization that responds to people affected by poverty or disaster with life-changing medicine, supplies, or health programs. Americares operates in more than 90 countries in all 50 states. I was fortunate enough to have spend some time with Michael yesterday while he was at Horizon, and we look forward to continuing our partnership with you as the years go on. A global health professional, Michael also, with 2 decades of experience, he was previously at MAP International, where he led humanitarian assistance and relief aid. And finally, our moderator, Roger Thurow, is a senior fellow on global food and agriculture at the Chicago Council of Global Affairs, following a 3-decade career covering global affairs at the Wall Street Journal. He is the recipient of Action Against Hunger's Humanitarian Award and is the author of several books on hunger and nutrition, including The First 1,000 Days, A Crucial Time for Mothers and Children and the World. As mentioned before, we'll take questions from the audience, and you can also submit questions online. Just as a reminder, if you have an internet-enabled device, type in chi.cnf.io directly into your browser and select today's program to submit questions. I will now turn the panel over to Roger. Thank you.
Thank you, Jeff. Thank you, Jeff, and thanks to all the panelists and speakers before. Sharita, you were sitting over there so quietly, right, and placidly, and I was kind of going through my notes, and all of a sudden it was an explosion on the stage. And so, thanks for the adding to the energy and passion that's in the room and that we see, and that's great. And we'll try to continue that with our conversation here. And yeah, thanks, Jeff, for so keenly teeing up our conversation. The first 1,000 days that we've heard about already discussed is this period, this time between when a woman becomes pregnant and the second birthday of her child. And for me, in my reporting, I found that this is truly the most important period of individual human development. And by extension, then it becomes the most important period in the development of our families our communities, our societies, our nations, and our world as a whole. And all that development is fueled by good nutrition and everything that supports it. So good and safe and clean water, sanitation, hygiene, certainly women's empowerment, the role of women in families and communities, the issue of land rights and empowerment issues that was raised. So all these things that also then support good nutrition. I also just wanted to reinforce and re-highlight two facts that Jeff stated, and I really want these to sink in throughout our conversation. First, 1 in 4 children under 5 years old in our world today is stunted in some manner, physically or cognitively. The clinical definition of stunting is too small for age. And there's international standards and measurements, things that the World Health Organization, things are put together that one can measure that. But that clinical definition doesn't do justice to what the impact of stunting really is. I mean, stunting is this horrible, blunt, rude, awful word, stunting. But what stunting is, it's a life sentence of underachievement and underperformance that's usually rendered by the time a child is 2 years old. So by that time already, life's so restricted. A stunted child becomes a stunted adult. The second fact he mentioned, that the cost of malnutrition and stunting on the global economy in terms of lost education, lower productivity, higher healthcare costs throughout life is measured in trillions of dollars. Those are huge numbers. But for me, the greatest cost of malnutrition and stunting is immeasurable. What might a child have accomplished if he or she wasn't stunted? A brilliant poem, or a song that we all remember, or a great novel, a revolutionary innovation, or a cure discovered for some disease that we can't get our arms around. A lost chance at greatness for one child becomes a lost chance at greatness for all of us. So that's the impact and the importance of the 1,000 days. And that's why we're having this conversation here this morning, and so important. So we'll jump right into that. And Laura, I mean, with your experience as a doctor and everything that you're doing, why is investing in the 1,000 days of life and maternal and child health so pivotal to healthy futures? Again, not just for the child, but I mentioned for all of us. And what investment should be prioritized?
In 1 to 3 minutes or less, is it?
Exactly.
Well, Roger, first let me say, I mean, it's an honor to be a part of the whole presentation today, but also in terms of your work, which is really inspiring around this. It's a big question. The easy answer is that we know that what starts in early childhood doesn't stay in early childhood. And so a lot of my work is focused on life trajectories. And again, I started out biomedical sciences, I did cellular molecular biology, pediatrics, thought I was going to be at an academic teaching hospital as a residency director. And I've found myself crossing far into realms that include economics, business, education, childcare, injury prevention, because if we look at what happens in those earliest years of life, and again, people tend to say, whether it's the first 1,000 days or birth to 5, birth to 3, you name it, what we're talking about actually does include pregnancy, and if you really wanted to get into the epigenetics, we're talking generations before, right? But for the sake of this, we'll just say in these early years, when we start to look at some of those core factors, and nutrition certainly being a key part of that, but so is the social emotional skill development and the caring responsive adult interactions with young children. One food for the mind, one food for the body, but both critical for maximizing potential. We know that that's that foundation period. I like the analogy of a house. We don't think of building a house without a foundation, but oftentimes that's what it feels like we're doing when we neglect nutrition, education, parental supports, when we know that a caring, responsive adult is perhaps the single most important factor for getting children, especially those most at risk, off their life trajectories. So again, there's lots of directions to take that, but again, I like people to recognize it doesn't matter to me whether we're talking about 0 to 3, 0 to 2, 0 to 5, all of it. I'll give you one interesting observation in the world of education, because what I partly am trying to do is link together worlds where we're all having these conversations, but people don't know that it's happening in another sector. And you'd think that health and education might sync up, but they're very disconnected. In the education world, everybody has long focused on third grade reading scores. The reason being that if you can get a child to 3rd grade reading level, that they have the opportunity to hopefully learn, they learn to read so that they can read to learn and they can become self-sufficient. So I was really struck when I heard a question at a Global Business Leaders Summit on Early Childhood at Harvard, and the Harvard Center on Developing Child presented information suggesting that 18 months predicts future 3rd grade reading scores, 18-month vocabulary. And then we get right back to the what happens in early childhood doesn't stay in early childhood.
Yeah, and that whole notion of education or the interaction with the parents, with the caregivers, so important. And a lot of this work and research, being done not far from here at the University of Chicago. And it was there in reporting the book that somebody said it was also profound that words are also nutrients for the brain. And
Your
also so
30
important.
million word initiative is based here in Chicago as well, doing really impressive work.
Yep, absolutely. So Michael, Americares is developing and providing proven systems of care for newborn, maternal, and child health. Why is investing in early childhood development a priority for Americares and your great work?
Well, you think about the context that we work in, which are communities of poverty around the world and some of the poorest communities of the world, and the disadvantages that women face there, that mothers face there during pregnancy, during birth, in those early years. It's a completely different thing than we think of here, right? So if you think about the people in this audience, thinking about pregnancy today, think about the things that we would do, everything from being very careful about nutrition, listening, reading to the pregnant, to the fetuses, and think about all of that. And here's what's going on in the world that we work in. You're talking about women who become pregnant in situations where they don't have access to a quality health center, where they're actually afraid to go to the health center, where they don't want to deliver at the health center. And we know that the rates of child mortality skyrocket among women for babies who are not born in a health center, who are born in the homes in these sorts of places. So, we're talking about a totally different sort of environment there. And so we're investing in a lot of work, investing in the quality of local health centers to deliver quality care to women so that they feel safe to go there. So we do training of midwives in countries like Liberia, where just to convince the midwives that it's safe for them to direct pregnant women to the health center so that they can have a healthy birth there. So it's really at a completely different level that we're working there, but it's so critically important to get these children in these communities of poverty off to a healthy start, to invest in the healthcare system that's going to provide the backbone of their care for their mother and for them.
Yeah, so critical that I think sometimes, we look at places in the world, and even in our own communities, that why is poverty so persistent, or kind of the mobility out of that? And it's the realization that so many of the children in those communities are getting off to such a lousy start in life from this. And important also, as you'll see in the discussion, that we're trying to talk about things globally and locally, that these issues aren't just something that's over there somewhere, but they're so critical also here in our own communities. And to that, I mean, just kind of another amazing statistic or comparison on this, kind of looking at the local and global maternal health statistics. While maternal mortality is down 45% worldwide, and hooray for that, 33 women an hour are still dying in childbirth or during pregnancy. And despite 99% of all maternal deaths occurring in developing countries, the U.S. has the worst rate in the developed world and is rising, defying this global trend. So what's behind that? Why do we have in this country, richest country in the world, why do we have the highest rates of maternal mortality in the developing world, or in the developed world, and in the fraternity or collective of rich world countries?
Yeah, well, I think our own health system has its own shortcomings for sure, and we have such a focus in this country on treatment. On disease, managing diseases. So much of our healthcare system is focused on diseases, not on health. And if we would direct more resources, more of our energy, more of our brain power toward promoting good health, I think you would see completely different outcomes. This is one of my concerns about what's happening in the development of health systems in developing countries. We've exported our treatment-focused approach in too many places. And we're not getting enough of that health education either happening in some of the other countries. So I think a reframing of our health system here around health promotion first, and then disease prevention, and then treatment would be a great way to deal with that.
And to pick up on that, people have looked globally at that exact approach, and the countries that spend more on social services and prevention are the ones that have the much lower healthcare costs. In the US, we've actually, in 2016, a study was done looking at all 50 states, and the same holds true in the US, that when we reframe how we look at things and we shift towards prevention, that we see better health outcomes and lower healthcare costs. The challenge is a short-term, long-term problem. And I always say, in a business community, I say it's the equivalent of living by quarterly earnings. If you're chasing the short-term return, then we put the Band-Aid on and we do the treatment, and we've designed our systems that way. I think what's challenging that, and I am hopeful that we're seeing a shift in the US as we look at health systems transformation, is a shift from 2 words to 1. Because the minute you go from healthcare to health, I laughed because I got into that space a long time ago, and a lot of my academic medicine colleagues thought I was crazy, like I jumped off a cliff. What was I doing, whether it was the internet or injury prevention or talking about books for babies? And when you shift over from healthcare to health, you all of a sudden end up doing things like STEAM education, girl empowerment, you talk about housing and transportation, and that much more community engaged, comprehensive, put the whole child back together again, as opposed to the siloed. And we see that in our approach, but we also see it in how we've separated our institutions and professions.
Yeah, just one other point on that. One of the lessons we certainly can learn from some of the communities where we work in around the world is the real power and effectiveness of community health workers, community health volunteers. So we see it really critical that every single health center has in its sort of orbit trained community health workers that are going out into the community and doing health education and working with women and children and families and improving their health, not just working on the disease side. And if we did that here, if every local clinic, if every hospital had a team of volunteer health workers who are out in communities doing health education with people, I think we would see that turn. And really, it's the most cost-effective investment you can make in health is in that. It's so much less expensive to train up volunteer health workers and get them into the field rather than always the high-tech technology that you find in the hospitals and clinics. I remember being in the Philippines not too long ago, and a little tiny health center we work with there, and they have one health worker and a doctor and a nurse in this little health center, but they have a dozen community health workers who are fanning out into that community, and that's a pretty good ratio right there. Put a dozen healthcare workers for every volunteer healthcare promoters for every medical professional in our system, and I think you'd see big changes.
So Laura, the shift you were talking about, healthcare to health, where does that begin? I mean, so the community education and outreach, but like at higher levels as well, and then I'm assuming also in medical schools and the training. So little that's talked about in medical schools and a long education for doctors and our medical professionals. Just so little discussion on nutrition. And on this time frame, right?
Sure, and to the question about nutrition earlier, I mean, part of the challenge is, and this is sort of a global shift, I mean, it's not unique to this topic of conversation, is the world's become very complex, globally connected, and to take on one piece of that challenge, all of a sudden you end up, as somebody doing PhD work in nutrition, and all of a sudden you find out that you're supposed to solve housing, transportation, business economics, the hospital system is very daunting. So I think partly it's a complex challenge problem. What I spend a lot of time is in the area of translation. How do I take, and again, you are the master of that in terms of what you did in the last hunger season, putting a human face to these challenges, where if I am, for example, interested in a 2-year-old and their cognitive development, you now, through your work, have me interested in climate change and farming and all sorts of other issues because I see how it relates. I think that's our challenge. And the minute that we help people see how it all relates, I said, I don't know how we got the field of nutrition so far removed from the field of health and medical, but we have. I have a soccer-playing teenage son who seems to have missed that memo that what you put in your body helps, fuel what you do. And I'm waiting for it to click, right? But I think that's where, when we start to put those pieces back together again, I am hopeful. I do see a lot of shifts in the work that I do at the national level in health systems transformation, and where I see it most, by the way, is in mental health. We're putting back together this, I use developmental screening in early childhood to get to the first 5 years discussion. Who owns that space as a profession? And if you talk to pediatricians, we think we do. But if you talk to early educators, well, the education system's responsible for developmental screening at an early age. And then you go to, Easter Seals National Conference, and they tell us that they're the biggest screener of people in the country, developmental screeners. It's disjointed, but that's where coming together around mental health is forcing communities and systems to pull together, and I'm hopeful that that's across a lot of disciplines.
Yeah, excellent. So that's one of our tasks going forward. We'll open up to questions now. So we've got all our mic people stationed around, so raise your hands. There's someone back here who's pointing to something. Oh, sorry. I need to put my glasses back on. I'll pause and do that. Thank you.
Hi, my name is Carol McGilvery. And when you're talking about the increasing mortality rate for babies in America, the one thing you didn't talk about at all, which I wonder would be part of the cause, is drug issues in the country, if that's factoring in. And also the other question is, how is the U.S. doing in terms of the first 1,000 days, nutrition, et cetera? Because again, there's a lot of inner city poverty, kids not being fed enough. You hear a lot about this. I'm just curious how we're doing on that front as well.
I'll first comment. Actually, our infant mortality rate has been doing well. It's the maternal mortality rate, and people looking at that think that in part it's because we siloed and focused. The last 50 years, we've done a really good job of dropping our infant mortality rate, but without paying attention to the mothers. And certainly we see increased rates of maternal mortality, rural, race, poverty, those sorts of things. There's also all sorts of other factors, whether it's older age of pregnancy, there's drug use, there's all sorts of other issues. So again, it's not my particular area of expertise, except to say that I see a shift as well. Because even in the entire field of pediatrics, the recognition that if you're going to have good outcomes for children, you must, not optional, you must focus on the caring, responsive adults in that child's life. And if they don't have them, they need them, is a very different message if you're trained like I was in the 80s, 90s, where it was very biomedical and very focused on the child, and you just helped the parent before discharge, right? I mean, it was to make sure they had what they needed for transportation. But now it's shifting. I'm hopeful that that will help shift over in terms of maternal mortality, where we realize that if mom's got, postpartum depression, that it's really important for that mom. It's also really important for that child, for both outcomes.
Yep, thank you. And I would just say, kind of from my reporting on this, and in the first 1,000 Days book, I follow moms and their children through the 1,000-day period in India, Uganda, Guatemala, and Chicago as well. So to your question of kind of what's going on with the 1,000 days and the importance of that here, it was remarkable that kind of the same education that one found in the other countries was also so vital here. Just simple nutritional education, cooking classes, how properly to prepare the food and to keep the nutrients and to present them. And then also the same kind of behavior change notions that you figure, why are they doing that in Uganda or India? That doesn't make sense. It's the same things here, and the moms that I was writing about here, they're talking about having to overcome their addictions to the flaming hot Cheetos and the Takis and the ramen noodles. And it's then you see kind of the cultural tide that people that are trying to do something, and the community workers in the 1,000 days are trying to do, whereas one of the doulas for the moms from the Ounce of Prevention Fund here in Chicago, it was almost house to house and mom to mom work that they were doing, and house to house combat of going around like with a kiwi and saying, this is something that's healthy. It's a weird looking fruit, and then you cut it in half and it's still strange looking, but try it. Here's how you can eat it. It's nutritious. At the same time, there was an after-school program up in Minneapolis for junior high and high school kids, and they were doing music videos. And they had put one together that was basically singing the phrases of these hot Cheetos and Takis and kind of the red stain on the fingers from the Cheetos. That had gone viral and had been seen by like 11.5 million people or so. So that's the messaging that's out there in the culture, as opposed to kind of mom to mom, house to house, home visitation to home visitation. Here's the healthy food. Here's what you should be doing. So that's one of the things kind of in our society that one is going or having to fight against. Other questions? Yep, here's one.
Hi, I was wondering if you guys could talk about the role of partnerships. You've talked about the role of governments and nonprofits, and what role the private sector plays in delivering impact in this space.
Thank you. That was one of the questions I was going to ask. So, Michael, if you...
Well, I certainly would do that. As a global organization, we're engaged with lots of other NGOs. We're engaged with lots of other governments. We pay very close attention to the priorities and the needs of ministries of health in the countries that we're working in, make sure we understand what their plans are, that we're aligned to them. And we also work with a lot of corporate partners and others who are connected to our work, bringing both funds to those work, but bringing their own expertise to this work. And it's one of the things great about being at a forum like this, is because we're bringing together in this room practitioners who are working on the ground. We're bringing together government officials, and we've got wonderful corporate partners like Horizon, who's sponsoring this event, is a great partner of ours, really focusing on not only their business, but their responsibility as a good social partner. So I think when we can put all of those pieces together, governments, not-for-profits, the private sector, and other kinds of actors, I think we make a bigger difference. And I would also say that the key thing is, in the communities where we work, is real serious partnership with the local community. In our case, it's working with local health centers to make sure that they are actually leading and that we're listening to them and following their priorities and being a good partner to them.
And I'll just chime in there because the reason, in the book that I just wrote, The Toddler Brain, I actually tackle that in the sense that I realized there was a very vast divide between the early childhood world and the business and economics worlds. And it's a different language. And I thought, you know what, unless we recognize, because I believe that those partnerships are absolutely necessary to deal with the global complex challenges, whether you're dealing with it locally or not, I translated the why do economists need to care about the first 1,000 days? I mean, why invest? And what's happening, I'm happy to report, is that the business community is hearing that loud and clear, but they don't always understand it. The U.S. Chamber of Commerce, if you missed it, just had me give a keynote at the end of June at their first ever early childhood and the workforce convening. But it takes translation, right? So a room full of early childhood people together with a room full of CEOs, and it's like a foreign language. What I've done is I went to the core, and it gets back to the discussion of STEAM education and empowerment and leadership skills. And I said, what are these skills that everybody believes in, right? Communication, collaboration, teamwork, adaptability, social, emotional skills. And then I said, let me translate for you what those look like in the first 5 years. And then I quote Peter Drucker and others in the business and innovation world. And now I have their attention. And it seems to be taking hold in that the business community is hearing we should be investing early, whether it's specific to nutrition or maternal child health or whatever it may be. But I think it's inherently necessary to do cross collaborations, because if we don't get that right, the problems are really big, and I don't think one siloed area can tackle them efficiently.
And one other quick comment to that too. This is not just about being good-hearted people wanting to do good in the world. This is about the head as well, thinking about the development of our country, of other countries, and from a business lens, even as future markets. We're investing in health. Health, we believe, is the gateway to the rest of development. If communities are healthy, if parents are healthy, if kids are healthy, they're going to be able to take advantage of educational, employment opportunities and ultimately become markets for companies. And so that's a good thing, and we want to see that happen.
Yeah, that's what I was going to say. And I mean, so that, again, the impact of malnutrition and stunting, I mean, it weakens economies, it weakens business opportunities and all these things. I have this neat tablet and all these questions coming in, perhaps from some of you and then the wider audience. So the one that is seems to be trending is, so infant and the maternal mortality that we were talking about would be correlated with socioeconomic development. Could we attribute the high rates in the U.S. To inequality? And then kind of a similar question, or subsidiary. How do we promote positive child development in a way that distributes the responsibility across genders? We have half a minute, so less.
I'll say
It's
really
ticking,
quickly on the
right?
maternal mortality, from what I understand, it crosses all socioeconomics. We're not doing a good job. It certainly does hit harder in underserved communities, and whether, like I said, race and gender, gender issues and things all come into play. In terms of child development, again, that's sort of, it's a big topic. I think across all realms, it's learn to speak the language, and it's very compelling. The phrase I use is, tell me which return on investment you want to talk about. Individual, because I can tell you about the child sitting in front of me and what's going to help them be successful and maximize their potential. Is it societal or is it economic? And the beauty of this discussion, it's the only one I can think of where it crosses political lines, it crosses all professional lines, is the return on investment is compelling to invest in early childhood. Doesn't matter which type of return you're looking for. And we've seen the number on the screen from James Heckman here in Chicago, but the 13% return on investment. James Heckman and other economists set out to figure out which sector of the economy was best to invest in. They didn't set out to try to say, let's invest in early childhood and let's make a case for it. And of all sectors of the economy, early childhood is the one that proves to have the biggest return. And again, take whatever piece of that, whether it's nutrition, whether it is postpartum depression, whatever it is that impacts young children and their healthy development. And those numbers, by the way, do not include healthcare outcomes. And we know that diabetes, heart disease, hypertension, obesity, James Heckman and his colleagues here did a study where it showed that they actually improved all 4 of those health categories. They didn't do it, they found in the numbers, from high quality 2 years of pre-K or preschool.
10-second response, just to reflect something you said earlier, Laura. Let's not just think about health care, let's think about health, defined very broadly. And if we do that, I think we'll make a big change.
Excellent. Thank you for the great, fabulous panel and your attention. Off to Naven.